Thank you for staying with us on The Conversation. Now, UNICEF needs $165 million to save 2 million children from severe malnutrition. These children are at risk of death due to funding shortages for life-saving therapeutic food in 12 countries. Now, Africa's Sahel region is worse hit, with droughts, floods, and food shortages exacerbating the crisis. UNICEF's Child Nutrition Fund aims to support local food production, reducing reliance on global supply chains and promoting economic growth. Now, urgent funding is needed to save lives and prevent devastating consequences. Every minute counts. Joining us live is Nemat Hajiboy, UNICEF Chief of Nutrition, to speak more on this. Thank you so much for joining us on The Conversation, Nemat.
Thank you for having me. It's an honor.
All right, now, Nemat, UNICEF warns that 2 million children are at risk of death due to severe wasting. Can you elaborate on the severity of this crisis?
Thank you. So I'll just start by saying when we talk about wasting, we mean when children are too thin for their height. And this usually happens when there is an acute shock to the system. It could be because of poverty, it could be because of economic crisis, it could be an illness that happens. You know, when you and I also fall ill, we tend to lose weight. So a child becomes too thin, and if they become too thin for their height, they get to be in need of life-saving, what we call nutrition services. And if they don't get it, then they fall even more ill and will be at risk of death. So when we look at Nigeria and we estimate that there are about, let's say, 40 million children under 5, and we look at the rates of wasting in the country, we see that about anywhere between 9 to 12 million children in Nigeria at any given point in time are wasted, and of which 2 to 3 million are severely wasted. Now, thanks to the governments, donors, etc., we've been able to ensure, and you see the pictures there, that mothers get access to life-saving, ready-to-use therapeutic foods, which they can give to their children. But we know that the need is much bigger than the resources we have available. And hence this report that came out that shows that between now and in the next 12 months, yes, we will be seeing many, many more numbers.
Yes, Nemat, speaking of, the needs, the UNICEF actually did mention that funding shortages for ready-to-use therapeutic food is exacerbating the issue. How critical is this shortage?
How critical is?
Yes. How critical is
the shortage?
Yes, of the food, of the therapeutic food.
So, as you saw in the report, the shortfall globally is almost close to 2 million cartons of RUTF, which translates into, almost $170 million worth, and that's the shortage. In Nigeria, we're looking at a shortage of about 700,000 cartons, but this is also for Nigeria. We've calculated it as confined to places where the needs are higher. So I would say that in reality, the needs are even more. So the shortage is quite acute, and we would risk losing the lives of children who don't have access to these services.
All right. Now, we actually did a report a few days back on, malnutrition in Borno State, and, we saw everything that's happening and what the UNICEF is actually doing to help out. And that's just for Borno State, that's worst hit by floods. But we also have the Sahel region, which is also affected. I would like for you to describe the impact of, the droughts, the floods, and also the erratic rainfall on the food security and also on child nutrition.
Right. So you've touched on a topic, like I said, anytime there is a shock to either the health of the person or to the context, then it leads to greater malnutrition. So when we have climatic shocks like drought, which we had, I think, a year or 2 years ago, we have floods, which we've witnessed now, and definitely 2 years ago. This disrupts in whichever way, directly or indirectly, the food value chain, from farm to table. So it can have an impact on the harvest itself, where the harvest then fails if there's severe drought or heavy rains. It can impact roads, it can impact transportation. All of this leads to higher food prices and or scarcity of food, which has an impact on what people and especially children are consuming and ultimately their health and well-being. And that's when we see rates of wasting rise. Currently, we have data that will come out in the next few weeks. And I am very, very extremely worried because the numbers that we're seeing this year are very high.
Well, how do you, Nemat, respond to critics who argue that international aid often disrupts local economies?
Sorry, I didn't get the first part of your question.
How do you respond to critics, who argue that international aid often disrupts, local economies, thereby, causing some of these food shortages?
So thank you. I mean, I think people speak from different experiences, but the way I see it is children are children all over the world, whether they are in one country or another. And I think globally, we have a collective responsibility to make sure that every child, no matter where they are, has access to, has the right to adequate nutrition. That is enshrined in the Convention on the Rights of the Child. That is where UNICEF and we as UNICEF derive our mandate. So I believe it is not about disrupting economies, but making sure that we keep the child in focus and making sure that that child's life is saved. Now, how we reach that child and how we do it needs to be in today's environment more local, more sustainable, and more accessible. So in Nigeria, for example, I mean, I'm proud to share that the ready-to-use therapeutic foods, which is a critical commodity in saving children's lives, we have over the last 2 to 3 years now 3 manufacturers in Nigeria. And those manufacturers are now supplying this not just within Nigeria, but to the region and also globally. So having that production in Nigeria is actually not only making a commodity that's life-saving available quickly, but it's adding to the economy, creating jobs, and so on and so forth. So I think it's really about the how rather than the what.
Well, you did say that, you need to ensure that, the children's lives, are actually saved. Let's look at the consequences of inaction or inadequate response to this particular crisis. Can you talk to us about the estimated number of children who will die if this funding appeals is not met?
I try not to think about it because it's a depressing picture, but globally, like we said, the shortfall is for about between 1.8 to $2 million and 1.8 to 2 million cartons of RUTF. And each carton really, we equate 1 carton is needed to save the life of 1 child. So the cost of inaction would mean that we will lose. We risk that the growth and development of 2 million children will be impacted. And many of those, if they don't get access to services quickly, also are then at the risk of dying. So that'll be the cost of inaction at a global level.
Oh, that is quite a huge number. But can you provide an update on the current funding status?
Globally, I have to say that we are really grateful to many donors all across the world and to many domestic governments across the world who have made funding available to support this type of work across many countries, especially I would say 40 countries that are really, really affected by this crisis. We also have in place a very unique opportunity for governments to draw down upon. It's called the Child Nutrition Fund. It is a one-to-one like ₦1 to ₦1, $1 to $1 match fund that UNICEF manages, that donors have pulled resources into. And I'm happy to say that in Nigeria, we have about 10 states already that are putting money into this match fund and will be getting commodities. Jigawa State, for example, already put money in. They've received their commodities and are using it. Katsina has moved forward, and we have 10 other states that are coming to the fore. The federal government, the Ministry of Health, is also looking to put money into the Child Nutrition Fund to make sure commodities are accessible. And it is a great investment. If the government puts in $1 or a naira, they get a naira back in commodities. So I think the world, donors and others are coming together to find innovative ways of making sure the financing is there.
All right, now, Nemat, just before we let you go, what potential challenges or obstacles would you say might hinder UNICEF's efforts? What challenges?
Well, challenges can happen. So I say that, firstly, let me step back. The response that UNICEF contributes to is what I call an all of society, all of government response. The biggest challenge we can face is if everybody doesn't come together to deliver what we want to do, which is ensure that our children in Nigeria, in other countries are, grow, like not just survive, but they thrive, they grow well.
Yeah.
So if at any point in time, if there is a policy that's weak, if there is a service delivery platform that's weak, or if somebody doesn't play their part in this ecosystem of delivery, then we are always at risk. So a challenge could crop up anywhere. And some of these are human, are operational challenges. Some of these could be external challenges like climatic shocks, which we're currently witnessing in Nigeria.
All right. Well, thank you so much, Nemat Hajiboy, UNICEF Chief of Nutrition, for joining us and speaking to us on this very, very important conversation.
Thank you for having me.